Morning Barbados, good morning. Wake up, wake up, wake up. Morning to you.
We're back with you on Morning Barbados for this beautiful Monday. We had lots of showers of blessing from like Thursday right through,
Yeah.
and you know, at different points during the weekend. It affected one of the events that was supposed to take place during the Food and Wine and Rum Festival, but
Yeah,
we are here.
Sizzle Street
Yes.
also affected, racing, the championship jockey event.
Yeah.
And that's been put back until Wednesday. I
Yeah.
don't know if Sizzle Street will take place then.
But of course, something that's not being put off is Monday. Monday is here, so it's happening. And Dr. Andrew Ford, our dermatologist, is with us. And this morning, we are talking about Syringomas. So, Dr. Ford, good morning.
Yes, good morning.
Did you
Cassandra.
have a
And
good
Doug,
weekend?
and the
Good
viewers.
morning, good morning.
Yeah, it was great.
Wonderful. Did you take in any of the festival, or were you busy working?
I missed the festival this year, unfortunately, but I
Oh.
did get some rest.
Okay, that's important as well. So that's good. So tell us about this topic, Syringomas. What exactly is this?
Syringomas are some structures that you see around the eyes. There are many dermatological structures you can see around the eyes, but these are some skin-colored swellings that actually come from your sweat ducts. They are what we call benign tumors or growths that you get around the eye. So lots of people ask about that because, you know, there are lots of other things like moles that we may have talked about at intervals and other things that people want to know about. But they're harmless. It's just that you tend to see them in adolescence, and you tend to get more and more of them. No symptoms, but just there.
Sweat duct.
Yes, our skin is covered with sweat ducts. They help to keep our temperature the way that we'd like, and the sweat ducts help to get that sweat out of the body and to cool it down.
You mean sweat ducts and pores are the same thing?
No, pores are opening that the hair comes out, but the sweat ducts are openings that come from the glands. So these are structures that evolve from those ducts.
So why are we discussing it this morning? I mean, you must think it's important for people to understand what it is, but it is harmless.
Yes,
So-
it is harmless. The reason is that it is relatively common. So there are lots of individuals that actually seek consultation for them,
Right.
or actually to have them removed, because the one reason you may want to get rid of them is because of the cosmetic appearance.
What do they look like?
Yeah, that's going to ask you that. How do
Yes,
they
well,
manifest
I'm
themselves?
hoping we'll get some pictures soon. They actually look like skin-colored swellings that maybe range between 1 to 4 millimeters in size. But you notice that these swellings are coming from under the skin, so they're actually dermal swellings, not a superficial swelling. And they
Wow.
love around the eyes, as you can see in this picture here. So, and this
Yeah.
young lady has numerous syringomas. So you can understand why someone might be worried. I mean, it could look like acne and other conditions that
People
we
might think
have seen.
it's as a result of
And
lupus.
they wonder why aren't they leaving? Why are they just there and just not moving? And years go by. So that can be a big consideration. An older lady previously, and also now another young lady, but you can see that there was also one or two what Bajans call moles there as well.
I was wondering if there was a mole or
Yeah.
did someone
But
pick at
the important thing is that all races get this condition, and it's seen more often in women. But these structures, if you think about it, you start looking at people, you'll notice
Yeah,
that
I know now that I've
you've seen
it.
some people
Yeah.
with it
And
before.
I thought it was just some moles that hadn't, matured.
Yeah,
Can people
in evolution.
Yeah.
Can people mistake them for the butterfly rash associated
Well, anything
with?
that occurs on the face for the person without the requisite knowledge is a cause for concern. And you see the little dark papules here laterally on the face. That they're the so-called moles that we mentioned, which dermatologists call DPNs. We haven't actually done that topic yet,
Yeah.
but that's another very interesting topic that.
Do you know
we
why
have
they
left to-
happen?
Well, we don't know why it happens. It can be associated with Down syndrome. Of course, Down syndrome is very uncommon. It can be familial, meaning that there's someone else in the family who has it. And you can also have situations where you just extensively get syringomas for no reason. But the most common form is the localized form around the eyes. But this child, you wouldn't be able to see them as well, but there'd be some dark dots you'd see in the picture. And this child actually has some on the chest and on the arms. So it's just to show you that syringomas can occur in other parts of the body. especially the trunk, the abdomen, the chest, the armpits. It can occur on the genitals as well. So that can be something that would be quite disturbing. And on the inner thigh, especially the thigh on the right, you see some dark dots there. That's some syringomas as well.
But somebody might think that's as a result of chafing or something like that.
Yes, well, you know what, sweat ducts and hair and all those little structures, they tend to form bumps. So that's why your dermatologist usually has to look at your skin on the magnification to see if the structures correspond with hair or if they're independent of the hair, to try to make a clinical diagnosis. In this case, I'm just wanting to show you that this young lady had what is the standard of care right now, which is electrosurgery. So on the right, you can see some kind of burnt areas there, the inner part of the right eye. And electrosurgery is the main way of treating it. Of course, you can excise them, you can scrape them off and burn them, but because they're so deep in the skin, there's a high risk of recurrence, and also with the procedure, there's a risk of scarring. So your dermatologist would do a few, see how you heal before embarking on doing many of them. But this is one of the situations where the procedure isn't foolproof and you don't do it and have that satisfaction that you would with the so-called moles and some of the other things that we treat.
One quick final thing before we take a break and change the subject. Is there a propensity for the traditional Bajan treatment to squeeze them?
Of course, well, we squeeze everything and pick at everything, but it doesn't make a difference because this structure is quite deep in the skin and the dermis, so all those physical things make no difference.
All right, so we'll take a short break and then
Yes.
we'll continue our conversation and bring in some discussion on fungus of the skin and perhaps the nails as well. We'll be right back.
Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you.
We are back with you on Morning Barbados. So we started by discussing with our dermatologist the subject syringomas. So now hopefully you understand a little better what those are, and if you've got that situation, you know that there is treatment and it can be dealt with. Another thing that can be a bit annoying is when your body is affected by fungus, and I'm sure many of you have concerns, and Dr. Ford is going to help us understand how fungus affects the nails. So Doug, you want to take the first question?
Why? You're trying to say...
It's always Doug.
You're trying to suggest that, you know what I mean? Well, let's talk about fungus, because, you see many people, walking around with open-toe shoes, and all of a sudden there's a discoloration, particularly on the big toe. Is that fungus?
Well, it could be, and it may not
Don't
be
look
as
for
well.
mine, 'cause I will show you
but
my
we could
toe.
as well talk about the fungus, because there are different types of fungus. But the main type that affects the nails, they're dermatophytes, and there are various types of them that have long names, which I won't burden you with. But a fungus can affect the nail in different ways. It can affect it superficially, in which case there's a whitening and a dryness that you get on the surface. It tends to like though the edges of it and the tips. So you get unsticking, you get lots of dryness under the nail. That is very uncommon, very common. Sorry. So nail fungus.
And the nail gets brittle.
Yes, the nail can get brittle and broken, and usually it occurs on one foot and not the other.
Yeah.
It's asymmetrical. It sounds familiar.
It
doesn't
sounds
it?
very familiar.
Sounds
It
very
sounds very,
familiar.
very familiar.
Okay.
Yeah.
But a nail
And
fungus.
on the big toe.
Yeah, the big toe, it can affect any toe. It can affect the finger, the nails on the fingers. And nail fungus is something that usually requires internal treatment. There were a lot of studies in Europe that showed that a topical treatment worked, and they cited a cure rate of about 70%. But in Barbados, I find that topical things don't work as well, even though they can and they can assist in treatment. But certainly oral treatment is the best for a nail fungus. And for the toenail, you usually have to take that treatment for 3 months. For the fingernail, it's for 2 months, and there are lots of different options. But discolorations of the nail, even if darker, can have different causes.
So it
For
goes
example,
yellow, green, brown. What are
yes.
the
So there's
colors?
a
Blackish.
greenish black discoloration that you can get, and if you happen to get nail trauma, or if you do a lot of physical exercise, or if you decide to jump for Kadooment and you were wearing the wrong shoes, or somebody hit you on the foot, or something dropped on the toe. If your toenail gets unstuck from the base that it's on, then that potential space can grow something called Pseudomonas, and Pseudomonas gives out some colors. We'd shown Pseudomonas on one of our previous programs,
Wow.
and it's a dark greenish black discoloration. So
Those cheap sneakers. Yeah.
Don't look at me.
toe punching, all that football.
So that's why you need to keep your toenails well cut so that they're nice and level with the toe and not going over the edge, because some ladies tend to grow their toenails.
They do?
Yeah,
Way
that's a new
past.
trend now. Yeah.
I didn't know that.
Yeah, no, I mean way past the edge. They're like that. You know, they can point them in the right direction. You know, what, and I think nails as well. If you use acrylic nails, or you attach nails and they lift, I think that you can get a fungus that way as well.
Yes, you can get lifting of the nails. There are other conditions that can cause lifting of the nails. One is psoriasis, which is a topic we mentioned before. There's some thyroid disorders that can be associated with lifting of the nail, and also trauma. But cutting the nail is important, especially if you're diabetic, because if you don't cut your nails properly, or your shoes are ill-fitting, you can get ingrown toenails, and that can be very painful. The skin gets all swollen and red, and sometimes you can get inflammation or pus there, and it can be very, very, very painful.
Well, let's talk about some of the other possible causes. So feel free to correct me if I'm wrong. What should you look out for if you go to get, say, a pedicure or manicure? Because I think I heard somewhere that if the instruments are not necessarily well sanitized, using those foot baths and different tools, you can get some nail infections. Would that happen to be fungus?
Well, fungus is, as I said, very, very common. And one of the things with getting pedicures is the cuticle. Even though that's not related to a fungus, if your cuticle gets damaged, it prevents you from having waterproofing between the skin and the nail.
Oh, so
and
that's the purpose
that
the cuticle
also,
serves.
yes, the cuticle is a waterproofing. Even though it looks a little ragged and not very beautiful, it does serve a purpose. But yes, nail fungus is usually unilateral, and there's some dryness and discoloration. It can be on the surface, it can be on the edges, it can be on the tips. And once you see a nail that doesn't look the way that it used to, and it's unsticking and it has some dirt under it, and that discoloration and dryness, you should have it looked at to see if it's a nail fungus for sure.
I read somewhere where mold in the house can cause a fungus.
Well, mold, they're complex and simple fungi. So there's some that are, as you say, mold or yeast, and Candida is the yeast, or the so-called yeast infection. That's the more simple one. We would have talked about something called so-called liver spots, which is pityriasis versicolor. Again, that's another simple fungus that causes discoloration of the skin, lighter or darker with dryness that we mentioned earlier. So there are other things that can happen. But once you have a nail that's unstuck, almost anything can go under there, including the mold or yeast that you mentioned, bacteria, the same fungus. All those things can cause problems
So you need
after.
to keep it away from water. You
Yeah,
need to
'cause-
dry very carefully. What are some of the
Because
things?
perspiration too would
Yes, yes. Well,
exacerbate
certainly
it.
general care. Having a look at your feet. Sometimes we have our bath and we do things, but we never look at our feet. We never dry the
Right,
feet.
don't wash
So
them
we
either.
have to treat our feet almost as, pay the attention we would as though it were our face, and dry it and look at it every day and make sure that everything's okay, especially if you're diabetic.
Yeah.
Because most diabetics get foot problems because they just don't look at their feet enough. But keeping it dry, keeping the nails well groomed, looking for any changes, moisturizing is important. All these things really matter. And of
how-
course, if you play sports and you use a lot of communal things like showers and different places, the gym, swimming, places where you swim, that's going to be important.
Excellent, Dr. Ford. Well,
You're right.
it's all hands on deck for getting yourself clean and making sure that you are fungus free. Let's see your nails, both hands. Yes, very good. Very good, Dr. Ford. We hope you learned from this. You understand how to treat. I've heard about things like Batrafin for treating the
Yes, there are
drops.
lots of topical things. Most of them are very useful
All
and
right.
very inexpensive too.
So even though you suggest the 3-month approach, orally,
you can try.
use something.
Yes, there are liqueurs, there
Yeah.
are drops, liqueurs, and various other things that you can try. So have a shot, and if you're not getting through, then the doctor's always there.
You swear.
High five. All right. We will be back. We'll tell you about the. Are you okay? Drink something.
Yeah.
We will be back. We'll talk with Wendy Lord. She's of the blood collection unit at the QEH. They're in need, and we'll tell you how you can help. Thanks, Dr. Ford.
Okay.